cannot prohibit you from personal travel, but we would like for you to assume responsibility. And if you're going to travel, you know, please don't go to Korea right now on a holiday or to, there's an epidemic there. We don't want you to come back and be infected. So personal travel should be reported, should be discussed. Use caution. It's not prohibited. It's only business travel that we can control. Any other questions?
Hello?
I saw people raising their hands. Yeah.
I think there's a lot of questions. I'm seeing a lot of questions about PUIs at Grady, and PUIs at Grady not being seen by people using N95s, and how do we get our masks? So I can tell you about getting our masks. There's been a lot of missteps. I'm not going to say that there hasn't. I just spoke to Dr. Jensen right before this, and he assured me that no matter who you are, a healthcare provider can get a mask from the nursing unit at whatever that patient is at. And if there's problems getting your mask, he needs to know about it immediately. I need to know about it. We will fix it. But this should not be an issue, getting a mask. How about the PUIs?
So I know it has been an issue. It should not be an issue, and we're working hard to address that. And squeaky wheels get the grease. So it's hard for us to, my heart hurts when I hear that you're having trouble getting what you need, but I still need to hear it so that I can try to address it. So don't quit complaining until we get it right. We will get it right. Everybody in the system is committed to making sure that our healthcare workers have what they need. For PUI, so one thing that has happened in the last couple of days at Grady is that there has been a confusing disparity between what the emergency department is doing and what the inpatient department is doing. And so that may be what I'm hearing, a concern that somebody saw a PUI patient and didn't have on an N95. And that, if that's what the concern is, it is true that the emergency department has already moved to the new approach that CDC endorsed, which was to use surgical masks and eye shields when dealing with patients who might have coronavirus, and that reserve an N95 for an aerosol generating procedure such as intubation. Well, that would be the main, that's the big one. For patients admitted to the hospital, till we have our official recommendations accepted and endorsed, which I think will be very soon, until that time, we are using N95s, in other words, airborne precautions, along with contact precautions on the inpatient side. That will not persist going forward for long, but today and Saturday and Sunday for sure, that's what it is. So there is kind of a disparity.
So there's a lot of questions coming in through the chat. Number one, can the slides be made available? Yes, we will make the slides available. And number two, you know, if symptoms develop, when is it okay to return to work?
Our policy that that I proposed and that has been discussed, and I believe that the leadership is comfortable with, and that you should see in print soon, is that people who have symptoms from the day symptom onset, they should stay away from work for 7 days, or 72 hours after symptoms resolve, whichever is longer. That is a long time.
Now, the next question is, should we temporarily suspend clinics, elective procedures? We're not there yet, but it may be, but we need to start thinking about three things. Number one, you need to start making plans in your clinic with your managers about things like, okay, how do we deal with healthy patients, i.e. the person that is doing fine who just needs to come in for the refill so they don't come. People that don't need to come, we need them not to come. We're working to for the hospital and others to get 90-day supply of medications, and make sure that we are trying to avoid as many people from coming in.
Don't leave me back here.
But I can't read this form.
Oh.
So what about if I sneeze and my kid is sneezing and coughing all over me? I have, you know, the sniffles, sneezing, nose congestion is actually not part of the syndrome. I wouldn't worry about it. Very rarely do we see sniffles out of this. Okay, there has been information in multiple languages. In Clarkston, there's more than 60 languages. I'm wondering that our places like, well, again, I would love to help, but we really need public health to step to the plate and do that. Grady is not going to be able to translate to every single language the information, but I'm sure we can get this to Dr. Kathleen Toomey, the state, and they ought to be able to get information in different languages. Okay, how about patients, immunocompromised patients? Okay. The problem is, what do we define as immunocompromised? We really don't know the impact on this on immunocompromised patients. I can tell you in patients with HIV who are doing fine in antiretroviral therapy, there's no apparently greater risk. We don't know about immunocompromised. So many immunocompromising drugs nowadays, we're really not aware. My advice is you're immunocompromised, you need to be extra careful. I cannot say more than that.
Right, and there's a lot of questions about when we're going to stop doing elective cases, when we're going to stop bringing in older people, when we're going to stop bringing in cancer patients. You know, we've made recommendations to Grady, and they have to develop the steps to implement those kind of things.
But they're certainly aware that those are good strategies to consider.
But I want to say, honestly, the other thing, we need to think about it. We're still not having a flood of cases. And if Grady were to stop elective surgeries today, we would be in a financial disaster in 4 weeks. So cutting elective cases can be worse than the flood for Grady. So you have to realize that Grady is not going to do that until there's absolute need to do that. And quite frankly, Emory Healthcare is doing the exact same thing.
Yeah,
Right.
both health systems are doing the same thing.
So
There was a question about medical students.
Okay, medical students,
I think this way.
there's a question about medical students, and basically, as far as medical students, the advice that the medical school, we work closely with the medical school on this, the advice from the medical school is medical students should not be involved in the care or evaluation of patients with COVID-19 or potential patients under investigation. Now, it's going to get difficult pretty soon just because maybe everybody's going to be a patient on an investigation. But at this point in time, that's the recommendation. The other recommendation is, as we are trying to save personal protective equipment, if you're seeing a patient with tuberculosis, we want one person or maximum two to go into the room. We don't want the entire team. So do more rounding outside, do more rounding. And I can tell you, Grady's also going to be trying to limit the number of people who are in isolation rooms and in other areas. And the medical students, of course, are part of that. So balancing the learning with the experience and the risk for our medical students is something that the School of Medicine is looking carefully at. As far as residents, we want to be sure that the residents are trained on use of PPE. For clinicians who work on the oropharynx directly, is an N95 mask required?
So not if what you're doing is a person who feels well and you're doing your usual care in the oropharynx. I think you probably wear a mask to keep from getting splashes to your face, and that would be appropriate. If the patient has a fever, then yes, that would, working in the oropharynx is potentially aerosol generating, and we would want you to have an N95 mask in that setting. So those people from oral surgery and ENT, we want to make sure we have some discussions about what you're doing and how we can be sure you have what you need.
Okay, we are concerned about PPEs in outpatient clinics. Please send an email exactly with what clinic and your concerns. We'll get them to Dr. Carroll. I think we need to be sure that outpatient clinics have the necessary PPE.
And Dr. Carroll's been working very closely with the leaders in ambulatory clinics, but there's going to always be more to do.
How should teams prepare for hospital surges? I mean, I think what we talked about, you know, I think about this epidemic as a hurricane. I don't know if we're going to get a Category 4 or a tropical storm, but we need to prepare for a Category 4. We need to start thinking about how are we going to work together, how are we going to bring more teams, et cetera. And each service is really going to have to think about this. It's not going to be simple. What about attending religious services? Again, anything over 25 people, you should not attend. And I would encourage you to not do that. I think there's a risk of transmission.
And Carlos, I'd like to say something about surge planning. At some point, if we have a bad epidemic, we're going to overwhelm our ability to put everybody in negative pressure rooms. And that's okay. You can take care of these people as long as you're wearing the appropriate PPE and you've got a mask on them. Right now, we have the luxury of having a lot of negative pressure rooms. In the future, we may need a ward where we cohort all the ICU patients and all the PUIs and all the proven cases, and those wards will not be negative pressure nor rooms, and that'll be fine.
Okay, people are asking about if we don't have face shields, what do we do for eye protection? I would tell you, as somebody who wears glasses, it's really hard for me to wear a face shield because it's just changed. So my glasses, I find, I'm not going to be doing an invasive procedure to go evaluate a patient. If there's not a face shield, I'm fine with my glasses.
But we do have goggles.
There's goggles,
that,
also. I was
that
going to
are
go
like,
there.
okay. There are goggles that are like see-through sunglasses that fit over most people's glasses. And we will be, we will have those at the rooms where PUI patients are. And we will be cleaning those as you leave the room. We'll collect them. We're going to send them downstairs to be washed with Clorox water, dried, and brought back up so that we won't run out. We have lots now, but we want to
Okay.
stay with lots.
How do we contact Dr. Ray to identify PUIs after dark or on weekends? Dr. Ray doesn't sleep, but I'm going to get her to ask
so the PIC number that is covered by me and my close friends at this point who have really helped me out is 103-198.
Okay, everybody take that down. We'll say 103-198 is the PUI PIC number.
And so we do get calls throughout the night. If you don't need to know the answer in the middle of the night, I'd appreciate it if you waited till the morning. But if yours is something you need to know in the middle of the night, that's why we're on call.
Okay, how about telemedicine? Well, in the conference that the president just had at the White House at 3 p.m., he gave powers to the Secretary of Health to establish all sorts of things, including telemedicine and other things. We have a problem that here we don't really have at Grady an infrastructure for telemedicine, but
There's a lot of interest and commitment to working on that, but it
Right.
won't happen tomorrow.
Yeah.
What about I feel sick and are there clinics available for me to come if I'm a staff member? Well, I think we're going to give the same messages to staff as we do to patients who call the nurse advice line. Yes, don't just come. Call your supervisor, and you can call employee health, and we will have someone speak with you. If you have a mild illness, we will encourage you to stay at home. And if you are ill in a way that is concerning for serious complication, we will help arrange for your clinical care, and that will be different depending on who you are and where you are, and et cetera.
And I will also say Emory Healthcare is setting up a clinic in an old clinic that the nursing school had. They're setting up this clinical side that is going to be like the testing COVID side that is going to be available to CDC employees and Emory employees and Emory Healthcare patients. It's not up and running yet. Probably next week it'll be up and running, but we will get that information to people. And that gets me again to another very important point. If not every day, at least every other day from my office, we will have a short email with key points that you need to know, the new developments, like the Emory Clinic is now open. Please read it. It's going to be short, but it's going to be important. And it's going to have new updates on what to do, because as things are being ramped up, things are going to change. The state today talked about trying to establish drive-through clinics where people can get tested. As soon as they're up and running, we will have those. So please read the information.
Is the N95 safer if a patient coughs and generates aerosols? Just coughing is what we are protecting against by wearing a mask. The N95 mask is not better than a surgical mask in terms of the material that the mask is created from. The material that a surgical mask is made from will protect you from virus droplets in this just as well as N95 mask. The potential benefit for an N95 mask is that it guaranteed stays put when you put it on.
Okay, the question came up. A patient may cough during an exam. Isn't that aerosolized, and shouldn't we choose an N95 for exactly that reason?
That's the same.
That's what I
thing
was
she
just answering.
said.
So
I mean, I think the influenza study showed that a surgical mask protects you just as well against a viral respiratory infection as an N95 mask.
the reason that they recommend an N95 for aerosol generating procedures like an intubation is that these are procedures where you are frequently in motion. You are focused on, your eye is on the prize, you are watching your hands, and you have to be able to move physically in a way that is the right way to be skilled and get the procedure done. You want to make sure that your clothes don't fall off during that, and that includes your mask. And so an N95 is going to stick because it has great elastic and it stays on your face. If they would just please make a surgical mask that sticks like that, you know, we'd be great. The surgical masks that we have, if you take the time to tie them on, the top and the bottom, they do the job. But because we want to make it easier for people to get the mask on and be mobile while they're doing procedures that create aerosols, that's why the N95 is recommended.
So,
It's-
Susan, one of the questions that I think is very important is people are asking not about suspected cases, but what if somebody's confirmed to have COVID and you were exposed, they weren't wearing a mask and you weren't wearing a mask? Where do they go for guidance?
Well, we should be calling you, but if you haven't been called yet, you can call us. Our current policy, which is consistent with what is planned, our current plan, I'm not sure if the policy's been approved. Our current plan and my recommendation is that we notify people who we know have been exposed to COVID-19 at work, and we are not, as a rule, going to be quarantining or sending asymptomatic healthcare workers home. We are, well, first of all, we're going to learn from any exposure events and to try to be sure that there was not a lesson there that will help us avoid that in the future. But then also we will identify all the people that we are have knowledge of having contact with that patient. We'll notify them, we'll keep a list of them, and then employee health will work to make sure that we are aware of your health status if you are such an exposed person. You will be allowed to come to work, encouraged to come to work, as a matter of fact, while you're feeling well. We need you. If you develop symptoms, we want you to report that and not come to work, and we will provide all the appropriate attention and care and support that you might need. And I anticipate, I mean, we have had people exposed already, and I'm sure it will happen in the future because it is very hard to be perfect in identifying people quickly. We're trying to be good at it.
I think there was a question about whether somebody was confirmed diagnosis but asymptomatic. What is the advice?
If they're in the hospital and they have a confirmed diagnosis, we are keeping them
A healthcare
isolated.
worker who has been exposed, confirmed diagnosis, asymptomatic.
The healthcare worker
Healthcare
Has-
worker.
has a confirmed diagnosis?
Correct, that was the question.
Oh, well, if a healthcare worker has a diagnosis of COVID, they're not going to come to work, even if they're asymptomatic. You're correct.
For a period of time?
Yeah, for 7 days or 72 hours after they are well. I have seen 2 patients so far that I'm thinking of in particular that were diagnosed. I was worried that they were going to become very ill. We admitted them to the hospital because of that concern, and they got well really quickly. And I was pleased, very pleased. So I think there are some people who will have a pretty short course. I would say their course of symptoms was 4 days. Some people will have a longer course. So that's what we'll do.
And again, there's a lot of questions that exist.
down.
There's a lot of questions that are coming. I will make sure, we will make sure these questions all get answered. We will put them in a document and get answers to people. The reality is we're learning a lot of stuff as we go along. We are answering things we don't know. We'll know things tomorrow that we wish we knew today. But the reality is, the reality is that things will not be a little rocky for a while. It'll be a little complicated, but again, that's how crises are, and that's how epidemics are. And you know, we're building this ship as we're sailing it, and the reality is this is complicated, and we need your support and we need your help. This is not easy. This is a crisis, and crises are not clean. They're messy.
They are messy and they're stressful.
Yeah.
And
So please remember to support everybody.
yeah,
And
You know,
I
it's
get,
easy to get snippy and mad with people and say, we didn't get this information, that didn't come through.
or Grady's not
Yeah.
doing this, or Grady's not doing that. Let's
Believe-
figure out how
yeah.
to solve problems. Let's work together to solve
Right.
problems, because we can actually work together and get this solved. I can tell you that I think things are beginning to align the right way at all levels. It's going to take some time, but I see good things happening, and I think over the next week or two, we're going to see major changes.
Yes, and if you read what's been happening at other centers where they're about 3 or 4 weeks ahead of us, it's pretty clear to me that the beginning for them was not perfect either. And that, and it's hard for us, people who are used to like being really good at stuff, to feel incompetent. But that is how we're feeling, many of us, and me included, because we're trying to juggle and figure out the right things to do. The right phone number to call in the middle of the night. If a new patient, please just call that PIC number 103-198. In the coming days, we're going to have a greater breadth of capacity you'll have more than one phone number to call for certain things. But right now, don't be afraid. Please call that number. It helps us to know what you're worried about.
I will just end by saying, this is not the end of communications. This is the beginning of communications. There'll be others. And I will just ask one thing from all of you besides being engaged, and thank you for being in this. Please don't panic. This is not the right time to panic. This is the time to stay informed, to stay engaged. And trust me, we're going to get over this. This too will be over. And if we work together, it's going to be over sooner.
Yep.
All right.
We'll get through it.
Okay, thank you, everybody.
Thanks, everybody.
Thank you.